Good afternoon and welcome to the City Club of Cleveland. I'm Lev Gonick. I'm the CEO of One Community. For those of you who don't know, our mission is focused on expanding next-generation public broadband across Northeast Ohio, and that's why we're so excited to be part of today's program. Healthcare providers across the country are adopting innovative methods for incorporating information technology and broadband into their daily practice. Whether it's collaborative remote surgeries, pharmaceutical modeling, or big data, IT is changing the face of healthcare around the world. Today's speaker is helping to lead the way in healthcare IT innovation around the globe. Lieber is President and CEO of HIMSS, the Healthcare Information and Management Systems Society. HIMSS is a cause-based, not-for-profit information organization focused on better health through better use of information technology. Mr. Lieber's presence here today is very important for Cleveland in particular. That's because HIMSS will be the anchor tenant when the Global Center for Health Innovation opens this October, adjacent to this brand new convention center that we're in right now. One purpose of the center is to house a worldwide innovation hub that for health IT will allow us to test, will allow us to engage in consumer product testing, the latest breakthroughs in mobile health devices, and all manner of remote medical technologies. An accompanying exhibition floor and the entire fourth floor of the building connected to where we are right now will be home to the Interoperability Showcase, a space that will demonstrate and test multiple products live every day. This space will not just be for health IT professionals. Part of the strategy that enticed HIMSS to invest in Cleveland is that the Global Center for Health Innovation will be open to the public, allowing HIMSS to be accessible to anybody who wants to learn about how they can use IT to improve their health care. Here's the thing that really matters about all of this at One Community. We know broadband is largely invisible to most people, but it is nevertheless changing the world. HIMSS is using broadband to change the healthcare world, which ultimately affects all of us in both beneficial and, as we know, controversial ways. There's much more to discuss, which is why we're glad Steve Lieber is here. Steve.
Thank you, Lev. I really do appreciate the introduction and to One Community for sponsoring this session. Good afternoon. As the City Club of Cleveland begins its second century of providing a forum for public debate and discussion, thank you for this opportunity to introduce our organization, Healthcare Information and Management Systems Society, as part of the Broadband Lecture Series. Before I begin this afternoon, I would like to acknowledge and thank some key individuals who have made our participation and our entry into Cleveland a reality. 6 months ago, Cuyahoga County Executive Ed Fitzgerald, in his annual State of the County address to this group, announced that our organization would be a charter tenant in the Global Center and occupy the fourth floor. Our relationship with County Executive Fitzgerald began nearly a year ago. The county's encouragement and support has been a significant part of the decision process, and we're very grateful to Ed and the entire County Council for their partnership in this endeavor. I also specifically want to acknowledge Matt Carroll, Mr. Fitzgerald's Chief of Staff, who has been very instrumental in helping us navigate through this process. I also want to thank Jim Bennett and the Global Center team. They have been absolutely incredible as ambassadors of this wonderful facility and this great community in making things possible. Also, last night we had a little get-together and I had the opportunity to meet Cleveland City Council President Martin Sweeney. Marty, I really do appreciate the opportunity to meet you as well. And along with Cleveland Mayor Frank Jackson, who have worked very closely with the county in making this new convention center and the Global Center possible, I want to thank you for your leadership in government in making all of this possible. And then in the local healthcare community, University Hospitals, Cleveland Clinic, BioEnterprise, Metro Health, Sisters of Charity Health System, along with the Greater Cleveland Partnership and Positively Cleveland, you have a tremendous group of boosters in not only the healthcare arena, but across the community who are driving great things to happen here in Cleveland. Today I want to talk about broadband, but I want to talk about more than that. I want to talk a little bit about health information technology. I want to talk a little bit about healthcare, a little bit about innovation, a little bit about where all of this is going. So if I had a summary sort of theme that I would put on today's presentation, it would be imagine the possibilities. Imagine the possibilities of broadband. Imagine the possibilities of healthcare. Imagine the possibilities of healthcare information technology. And we'll throw in there, imagine the possibilities for Cleveland. As introduced to you a few moments ago, HIMSS is a global not-for-profit organization dedicated to better health through information technology. We produce educational programs, market research and analytics. We build communities of healthcare professionals. We have media and marketing services. And across this spectrum of services, our attempt is to provide credibility, authority, and impact related to efforts to improve health quality, ensure cost efficiency, and enhance access to care through technology. Every year, more than 500,000 people worldwide connect with us and retrieve from our resources some piece of information to help them understand healthcare better or to do their jobs better. And underlying our platform, as well as the platforms that operate in most, if not all, healthcare organizations, is broadband technology, as it is now and what it needs to be for future success in meeting the needs of our citizens, who are also patients expecting and deserving of quality, consistent, and safe delivery of care in any healthcare setting. So let's put this in perspective and get a little bit of an understanding of what we're talking about that's happening across broadband today. Every day, we create 2.5 quintillion bytes of data, so much that 90% of the information that exists in the world today has been created in the last 2 years. Imagine trying to keep up with the body of knowledge in any one of your fields with numbers like that happening over such a short period of time. In healthcare, accessing patient health data and factoring it into clinical and advanced analytics is critical to improving care and outcomes, incentivizing the right behavior and driving efficiencies. With ever-escalating costs within healthcare, there is an imperative to reduce the cost of care and efficiently manage resources while at the same time not compromising patient care. The use of broadband technology very much enhances that ability. Broadband networks can be accessed through a variety of wired and wireless services, each of which offers unique advantages in speed, reliability, and affordability. Wired or fixed broadband services tend to be faster than wireless alternatives, but oftentimes cannot reach geographically remote areas. Users can access broadband services through a range of equipment, ones that we're all very familiar with, such as desktops, notebooks, tablets, and whatever. When combined with other information and communication technology resources, let's think about what broadband is intended to do and, in fact, does deliver. Ubiquitous access, making it absolutely seamless to access enhanced multimedia applications. It helps drive down the cost by virtue of eliminating the need of physical presence. It improves and allows for more frequent and less costly communications and other efficiencies. The FCC rolled out a national broadband plan in 2010, fulfilling a 2009 congressional mandate to ensure every American has access to broadband capability. According to the FCC, for healthcare, broadband can help transform healthcare in three important ways. It enables efficient exchange of patient and treatment information by allowing providers to access patients' electronic health records from on-site or hosted locations. It removes geography and time as barriers to care by enabling video consultation and remote patient monitoring. And it provides a foundation, a key point. It provides a foundation for the next generation of innovation and connected care solutions. So to understand, I'm going to provide you with some examples of just how broadband has made a difference in healthcare delivery. The Veterans Administration reports that broadband-enabled solutions has led to a 25% reduction in bed days of care and a 19% drop in hospital admissions at a fraction of the cost of other solutions. So comparing, a remote monitoring telehealth encounter costs about $1,600 versus over $13,000 for home-based primary care and nearly $78,000 for nursing home care. Truly a very cost-effective approach to the delivery of health care. The FCC's Healthcare Connect Fund began providing support on a limited basis for broadband connections starting July 1st of this year. It opens to all eligible healthcare providers starting January 1, 2014. The FCC's Rural Healthcare Pilot Program, on the other hand, is already in full swing, and there are a number of supported sites in Ohio. The need for and cost of higher broadband speeds has become a new priority. And it's something that we need to recognize that this is not a place that the United States leads the world. We trail in many respects, not only the widespread availability of high-speed broadband, but also its cost. There are efforts underway to remedy this. There's work with One Community as a great example of bringing those higher speed broadband solutions at a more cost-effective price to regions. But nonetheless, at the current time, we find that in today's environment, the higher speeds of broadband can be prohibitive for some healthcare providers as the cost per month of the higher broadband speeds becomes more and more expensive. These financial discrepancies, the ability to cover those costs, mean that about 10% of small providers face broadband connectivity gaps because they cannot afford the service or they're operating at diminished connection speeds. And in many rural areas, the broadband internet connection is not even available due to the lack of existing infrastructure. Nonetheless, the FCC is trying to move us forward in addressing these problems. For example, the efforts underway today estimate that by 2016, there will be nearly 18.9 billion network connections, or 2.5 connections for every person on Earth. So step back for a moment and think how many you have now. And in a room like this with an audience with this kind of interest in this subject, you probably already have 2 or more internet connections, but that will become the norm worldwide. By 2016, you will find 1.2 million video minutes traveling the internet every second. That's the equivalent of 833 days of video traveling the internet every second. So clearly the demand is nowhere near reaching its peak. It's going to require significant fiber capacity in order for us to carry all of this across the bandwidths. These statistics, which are taken from the 2012 Cisco annual report on internet traffic, clearly are fascinating and intriguing in many ways. Fascinating because it's mind-boggling to believe how much data and connectivity now exists, but also what is still to come. Broadband Expanded 2012, a recent study on stroke centers, found that over a 5-year period, the correct emergency stroke treatment decisions were made 96% of the time with audio, video, telemedicine technology, compared to just 83% with telephone consultations, clearly reinforcing the need to have a different technology than the older telephonic capabilities in order for us to move forward in that effort to achieve higher quality of care. There are numerous examples: Arizona, Hawaii, the insurance companies Aetna and Cigna, all of whom are undertaking various projects to reinforce the use of the internet and electronic consultations in order to realize the visions that we are trying to achieve of higher quality, lower cost, more efficient care. Verizon is launching a telehealth collaboration service initiative that will seek to solve that issue we have in remote areas in order to provide that last mile connectivity. Microsoft, GE, and Sprint also very much in work to achieve the efforts of establishing around-the-clock visits between patient and doctor. One example that I'd like to highlight that's more local: Steve Cashman of Powell, Ohio, created the Health Spot Station, which was designed by the Cleveland business innovation firm Nottingham Spurk. Using remote access to caregivers, patients connect with the physician via video screens at a Health Spot Station, a patient care option designed to reduce visits to the emergency room and help Medicaid patients find care closer to home. The Lewis Stokes Cleveland VA Medical Center and 13 of its outpatient clinics in Northeast Ohio began adopting a new telemedicine program that came out of the University of New Mexico. The Cleveland VA received $1.2 million last year to implement the pilot and expansion of the program. So now a patient needing to see a specialist for management of chronic illness or other complex issues previously received referrals to physicians outside of the VA system. Now with this program, the patient can consult with a VA specialist for more efficient, more cost-effective care by virtue of seeing someone within the system, and therefore also avoiding extra travel time and reimbursement expense. Here in Cleveland, as you know, we've made a big investment in the Global Center for Health Innovation. As described to you, the 4th floor will be a hub of healthcare innovation, demonstration, and testing. It is very much a part of our philosophy of bringing all stakeholders together to find the right answers. It's not IT people working alone because you'll only come up with the IT answer. It's not doctors working alone. You'll only come up with the doctor answer, or even hospital administrators working alone. You come up with a very narrow view when you don't bring all together. It's very much this effort we are going to establish here at the Global Center is part of an effort that we've undertaken for a number of years as we work to achieve seamless and secure exchange of electronic health information at the right time to the right person. We have worked to achieve a position as an international leader in interoperability, standards, and harmonization initiatives, and thus this effort in Cleveland furthers our mission to improve health with information technology. We believe that the Innovation Center, as a year-round destination for a variety of audiences, will help to achieve a better understanding of how sharing patient health information functions, how vendors will be able to better achieve that ability to exchange information, and that practitioners, that clinicians will be able to better understand how to harness the power of information technology as they seek to improve outcomes with their patients. Much of the activity in the adoption of health information technology over the past 3-4 years now relates to the Affordable Care Act that will ultimately provide more than $20 billion in incentives to eligible providers and hospitals. This legislation, which was part of the American Recovery and Reinvestment Act of 2009, has resulted in a tremendous increase in the implementation of health information technology across the country based on meeting the requirements of meaningful use, which is the foundation of this legislation. The Innovation Center, with our technology vendor collaborators, will provide us with an opportunity to further test and demonstrate those products which have achieved this expectation of serving the legislation, bringing providers to that position of delivering care that meets the criteria of meaningful use. As healthcare providers and hospitals work towards becoming meaningful users of the electronic health record, this year-round comparison service provides us with an ongoing ability as products change, as expectations of clinicians change, to be able to test and understand functionality before major financial investments are made. I believe that I can safely say Ohio is certainly emerging as a national leader in health information exchange and the use of health information technology, and has been well recognized in their achievements. Ohio has 2 health information exchanges. One is the regional HIE Health Bridge in the Cincinnati area, which covers 11 of Ohio's 88 counties. And it is an ONC, Office of National Coordinator, beacon community, and truly doing outstanding work in the southern part of the state. The other is CliniSync, managed by the Ohio Health Information Partnership, the state-designated entity that received $14.8 million in federal funding to create the HIE infrastructure for the rest of the state. As a not-for-profit, it has been able to use federal funding for implementation of health information exchange, as well as other funding for regional extension services that assist more than 6,000 physicians in understanding the complexities of adopting and using electronic health records. It is the largest of any single regional extension center in the nation. Right now in the Cleveland area, you have University Hospitals and the Cleveland Clinic as 2 major health systems that have committed to CliniSync. University Hospitals has 10 hospitals in its system, and the clinic has 11 that are now involved. They represent how important it is for leading health systems to break down the mortar and brick barriers of health information exchange and to allow communications across major health systems, very much reinforcing the culture that patient data belongs to the patient, not to the health system. But let's not forget the smaller hospitals in rural and underserved areas, hospitals that need and want to connect to physicians. In the past 18 months, CliniSync contracted with 95 hospitals to join, as well as more than 1,300 physicians, and it is expanding across the state in its physician outreach as each hospital goes live. With 146 hospitals in its 77-county area, leadership there explains to me that 100 to 110 hospitals will be on board by year-end, truly achieving a network of safe, secure, reliable patient information exchange. So how is all of this possible? It occurred because there are nearly 17,000 Ohio hospitals and eligible physicians who have received more than $600 million in federal funding over the past several years related to the Affordable Care Act. Statewide, 61% of your physicians and 94% of your hospitals have gone electronic, either by purchasing, installing, or upgrading to a certified electronic health record system, and the numbers continue to rise each month. Because collaboration and trust are key, and through the work of the Ohio Health Information Partnership, Health Bridge, and the Ohio Department of Health, 7,500 primary care physicians have adopted electronic health records. With all the federal regulations around meaningful use stage 2, connectivity outside EMR systems will become even more critical. As you know, much of what I've been discussing, broadband, telemedicine, health information exchange, mobile health, the HIMSS Innovation Center, Health Information Exchange, all are part of truly innovative work to improve our healthcare system. It's also important to note the economic benefits to the local economy of having this type of infrastructure in place. Such infrastructure, as well as a commitment for its continued evolution, can draw companies to locate in the region. Pulling together life science companies, researchers, academia, local and federal partners with other service providers and with potential capital sources, you can begin to meet the goals of stimulating the transformation of scientific discovery and new data intellectual assets into actionable care and population protocols, and facilitating business development, investment, and local economic improvement. Healthcare organizations have the opportunity to leverage big data technology to perform analytics to improve care and profitability. Yet going forward, higher bandwidth networks may be needed for requirements such as the creation of accountable care organizations or health information management settings where massive data sets and the need for analytics will drive the need for higher bandwidths. When it comes to embracing the benefits of broadband, you've already made an impressive start here in northeastern Ohio with One Community's efforts. With our presence at the Global Center for Health Innovation and the work that we are doing in interoperability and standards, I expect to be watching with you the healthcare and broadband innovations yet to come. Thank you very much.
Thank you very much. Today at the City Club of Cleveland, we're listening to a Friday forum featuring H. Stephen Lieber, President and CEO of the Health Information Management Systems Society, also known as HIMSS. I'm Dan Malthrop with the City Club. We'll return momentarily for our traditional City Club questions. You're encouraged to formulate your questions now and make sure that they're brief and to the point. We welcome all of you here and those joining us via broadcast on WVIZ PBS, 90.3 WCPN, and 104.9 WCLV IdeaStream, WTAM, or one of our many other broadcast partners across the country. Broadcasts of the City Club of Cleveland are made possible by Cleveland State University and PNC. Our live webcast is supported by the University of Akron. Today's program is part of our series presented in partnership with One Community entitled Broadband, Understanding the Fiber of Our Region. It's an exploration of the impact of broadband in education, healthcare, and economic development. Today's program is sponsored by Fifth Third Bank and the Global Center for Health Innovation. Thank you very much for your support. Today is the Medical Mutual Endowed Forum on Healthcare, made possible by a generous gift from Medical Mutual to the City Club Forum Foundation. Thank you very much for your support. And we welcome guests today at tables hosted by Baker Hostetler, the Cleveland Clinic, Cuyahoga Community College, Downtown Cleveland Alliance, the Global Center for Health Innovation, Medical Mutual, the Northern Ohio chapter of HIMSS, and One Community. Thank you all for your support as well. Now it's time to put you on the hot seat. Mr. Lieber, we return to our speaker for our traditional City Club question and answer period. Holding the microphones today are City Club Program Director Carrie Miller and Development Associate Michael Grimaldi. Our first question.
Mr. Lieber, welcome to Cleveland, and we appreciate you bringing your organization to the Global Center for Healthcare Innovation. I appreciate you explaining a lot about broadband, but I'd like to know more about your organization, frankly. Where is it located now? What size is it? Who are your supporters? Annual budget, staffing levels. Are you relocating to Cleveland, or are you setting up a second operation here? What will be the impact of your operation here in terms of employees and budget, et cetera? And since you're going to have people here, I assume, what were the characteristics of the community that brought your organization here, other than the help that you mentioned earlier of political support and leasing a nice building?
If I don't remember all those questions, you're going to have to cue me on some of those. First of all, HIMSS, in many respects, is a virtual organization. So in reality, this won't be the second place. It'll be the umpteenth place of a HIMSS presence. We're headquartered in Chicago. We have offices in the U.S. in Ann Arbor, Burlington, Vermont, Portland, Maine, Washington, D.C. We also have offices in Brussels, Berlin, and Singapore. So we're globally about 360 or so employees, have an annual budget of about $80 million. We are a not-for-profit organization that has members as a core. There are about 55,000 individuals worldwide who are the members of HIMSS. But as I mentioned in my remarks, we actually focus on a much broader audience than members, much like the question that was asked at the beginning of this meeting, how many are members and how many aren't. The reach of an organization typically is far beyond those who have signed up as members, because you have information that someone else wants. And it sometimes can be just a periodic exchange versus an ongoing one. And so we do. We have about 500,000 people worldwide who are accessing our educational programs, our networking opportunities, our tools and resources, our media services, our analytical services, and that sort. So as we look at what we are trying to do, and the mission of the organization is better health through information technology, we look at various opportunities to achieve that mission. And so we look at a variety of different options. We look at a variety of different geographies, because we are not U.S.-centric. We look globally. And so what drew us here was the work that was the thinking that was going on into what has become the global center. It's an opportunity for us to do on an ongoing basis the demonstration and testing of innovation in technology in a location where we expect there is an ongoing watch of the world in the healthcare arena to see what's going on. You look at the lineup of companies, starting with your local institutions such as University Hospitals and Cleveland Clinic, who are there. You look at one of your major employers in the health information technology space, Highland, who's there. And others, Johnson Controls and others, Philips, numerous big names in healthcare. This is going to bring a tremendous focus on the work that's being done here in terms of healthcare innovation, not only in technology, but across the spectrum. We're faced with, if we stop and sort of step back and think about what we're reading about in the newspapers and magazines and watching on TV about what's happening in Washington, if we step back from the rhetoric and think about what's going on, we've got a healthcare system that's in desperate straits. It's a healthcare system that is not sustainable for the long term. It has the potential of bankrupting the country. So we've got to get a handle on this, so we've got to find the way to drive costs down and drive quality up. So it's activities such as this that we think are key initiatives to help further that goal of lowering costs, improving quality, and therefore improving the overall healthcare system. So that was really the reason why here.
Hi, Mr. Lieber. I'm a proud HIMSS member, and
Thank you.
Thank you. You mentioned the Meaningful Use Program and the Affordable Care Act, and the interoperability standards associated with that. I was wondering if you could comment on the lack of infrastructure to really accomplish that interoperability, particularly for health information exchange, lack of a real infrastructure as far as health information service providers, and what HIMSS as a lobbying organization might be doing to help us explain the complexities there to the government.
Yeah. Infrastructure is a real challenge, and some of it I alluded to in the remarks. There is very much digital divide, not only between geographic areas, between the economic capability of provider organizations and inner city Medicaid heavy hospital versus a university-based academic center that may have a far greater foundation that can invest greater in that infrastructure. One of the things that we've worked on for years is dealing with the first part of that, which is standards. Healthcare technology developed in an era where nobody paid any attention to setting a single way, just to simplify and get out of technical terms, a single way of doing things. Everybody did their own way. Systems didn't match up. And we're now having to undo that. So I think the first real infrastructure question is getting past that barrier. I think the technology itself, the technology infrastructure, is getting there as we improve on the issues I touched on today related to speed and bandwidth. But I think the real significant barrier that we're still going to be dealing with is that of cost. The investment in all of this is extremely great. So back to our efforts as an advocacy organization, we worked very hard in that legislation that passed in 2009, which for the first time gave provider organizations funding for managing information. Doctors and hospitals have always been paid for delivering care, but there was no way to get any reimbursement for managing the information that came out of it. That was just something you had to figure out how to pay for some other way. So with the Affordable Care Act, funding came in and continues here for a few more years to help get people to that point. We've still got great challenges and great barriers, but I think if you look at the statistics in terms of where hospitals and doctors are today versus where they were 5 years ago, we've made tremendous progress to that point of actually being able to exchange data for the benefit of patients.
My question focuses on the data. Recent stories in the newspapers and on television have shown that credit rating agencies devote almost no resources to correcting the errors that creep into their system, or that are prevalent in their system. So my question to you is, in the area of healthcare information, what resources are devoted to seeing to it that the information is correct?
I think the advantage that healthcare has right now, and this is actually going to be a statement that some might interpret as being a reason not to exchange data, but data right now in healthcare is generally generated in one place. At university hospitals, a patient goes and sees a primary care physician, gets referred to a specialist in the system, may be admitted. It's within a closed system. They're not pulling data in from other sources that credit agencies have to. So there's, I think, a very fundamental difference in that. But the issue you raise actually is one that challenges us because there is other health data that you have that doesn't come from the university hospital system. It comes from other sources that really ought to be a part of your longitudinal record because other things are going on with you that the next practitioner ought to know. Because if he or she didn't know that, they might do something to you that wouldn't be good. So it is absolutely a serious challenge in understanding what the data is that's coming in, who it's coming from, and is it valid. And that's the real challenge we have with what's known as the personal health record, which may be consumer or patient-owned and have the ability for the patient to edit that, and do they start taking things out that really need to be in there, put things in there that really aren't quite right? You raise a very significant question that don't have an answer for you in terms of can we prevent bad data from getting in there, but it's certainly on everybody's mind.
Thank you, Mr. Lieber, and welcome. Recent special issues in Science and Lancet, reported in Time, are indicating the huge challenges we face in the healthcare system due to changes in our environment. So my question to you is twofold. One, from your organization perspective, where does this technology fit into the broad mission of public health? And secondly, since you're moving one of your offices to the the green city on the Blue Lake, what are the special opportunities here in Cleveland as we celebrate our city as a place of creative thinking about sustainability?
I think the main sort of observation that I'd make is around other factors that are affecting health and health status, such as the environment and such. We have to recognize that there are many things other than technology or your physician or the hospital that you use that's going to influence health status. Most studies tend to indicate that heredity and behavior have more to do with your long-term health status than perhaps even the care you receive, obviously excluding serious interventions that are required by a medical professional. But I think from our perspective, the use of technology in situations of public health underscored the importance of community and even nationwide exchange of data and collection of data. As we saw in Asia over the past few years between SARS and flu epidemics and pandemics, the lack of information being captured quickly across broad populations resulted in a slowness of recognizing what was going on. And that's one of the criteria that is built into the legislation we have, is the nationwide collection of some key health statistics so that we can spot early those issues in public health that require quick action so they don't become something of a pandemic level. So technology is very much at the root of that. I think that what we'll see here over time as we explore the various health scenarios that we're going to want to demonstrate and test, that ability to rapidly identify public health issues could very well be one of those scenarios that we could do here.
Mr. Lieber, this question is more in the political area than the technical area, but after all, this is a city club. And the question basically is relating to the health care you were referring to and the Affordable Care Act, the so-called, what the Republicans refer to as Obamacare. That law is supposed to come into effect, most of its provisions, in a few months, in 2014. The Republicans in Congress are trying very hard to repeal that law. I think in the House of Representatives alone, there have been probably 25 different efforts to pass legislation which would repeal that law completely. There's an election coming up in just a few next year also, and if the dynamics should change, if that law were repealed, what hope do you have for the millions of Americans who do not have health care insurance now being able to get health care insurance, and for those hundreds of thousands of Americans who have pre-existing conditions being able to get health care insurance?
Fortunately for what HIMSS focuses on, it's not most of what he just asked about. So we fortunately aren't tied up in the issues of pre-existing conditions and access to insurance and that sort of thing, but I'm still going to comment on it. Fortunately, in 2009, the legislation was passed. And step back to late 2008, 2009, what was going on? The economy was headed down the tubes. There was a serious problem in a number of economic areas. And the early days of the Obama administration looked at the situation and said, okay, we need to invest in, and back to the title of the bill, recovery and reinvestment in America. And so there are all kinds of recovery components to that, which we can debate whether TARP was good or not, and a whole bunch of things. But on the reinvestment side, the administration said healthcare, education, and energy were the three key business sectors that needed reinvestment. And that's where the funding came that's driving the innovation and investment in technology today. That's safe. That piece is bipartisan. There's no disagreement in terms of that program. Obamacare comes along much later and was passed just before the last election. I think my political observation on this is going to be that the election in 2016 most likely will make no difference on the trajectory of Obamacare, because even if the Democrats lose the Senate, the president still has the veto. And clearly, Obama will never sign a bill that overrides his plan. And there will not be two-thirds majority in either of those bodies to override it. So this program is going to happen. It's going to be underway. The first opportunity for anything to happen would be the next presidential election. And so, which actually is 16, isn't it? Yeah. So by January of 17, so the next election actually is the by-election in 14, we're safe for the legislation to be implemented through January of 2017. By that time, my prediction is many of the points that you just raised will become recognized as important components in the American healthcare system. That unintended consequences that result from pre-existing conditions not allowing you to obtain insurance, which was the case before, people will recognize that's an important component to retain. The ability to cover children up to the age of 26, I think it is, who are dependent upon their parents staying on their insurance plan. I think those types of things will become more ingrained and accepted. So even if there's change, which there will be, regardless of administrations, there will be changes to this. I think there's some fundamental pieces that the American public are going to see. These are good and are not necessarily the things that should be thrown out. But there are other changes that are clearly going to be likely to occur.
I've recently been working with a number of vendors who are involved in the storage and the management and the integration of healthcare information. Folks like Socrates Analytics here in Cleveland and Box.com. I'm very concerned that the consumer does not have an adequate voice, even with HIPAA, for the management of the security of healthcare information. Do you see HIMSS stepping up to be a voice for the consumer in the security of the information?
I see HIMSS having currently a role as well as a future role. Currently, we're very engaged in the conversation around data security. It is a subject that many are very concerned about because that's what we read about in other business sectors, the hacking in to databases and the identity theft and issues like that. So we're all very sensitive to the issue of data security. So currently, we work a great deal with companies and providers to make sure there is very strong education, case studies, best practices understanding about what's needed in data security. So right now, I'd say we are right there working on that issue with the industry and the provider sector. Going forward in terms of the consumer's voice, the problem that we have with consumers right now is, for the most part, unless you've got a chronic disease, I would say that most everybody in this room really is not an engaged consumer in their health care. It's just one of those things that we don't pay much attention to. Now, as I say, if you have a chronic condition that is ongoing in such a way that it is in your face all the time, of course you're a very engaged consumer. But that's really not the majority of the population. So we've got to get to that point where we take responsibility for our health care. We take responsibility for understanding what it means for my data to be available electronically. And one, recognize the balance we have to achieve between that electronic access and privacy and security. And as I say, I would agree with you that at this point, no, the consumers aren't deeply engaged yet, but we've got to get the consumer engaged on a lot of healthcare subjects, security only being one of them. We're starting to develop some thinking inside our organization about how to reach you as a consumer. And we haven't got the strategy figured out yet because we're not a consumer organization. We don't have millions of people that we automatically can reach. We've got the information that consumers ought to have and understand. We've got to figure out how to connect with them. So I'm with you there in terms of trying to find that way.
Mr. Lieber, this is, I think, a natural sequel to the preceding question because I wonder what services that actually reach patients, reach consumers, are possible with broadband, which I take to be shorthand for the fast flow of vast amounts of data. What services are possible with broadband that are not when you don't have it? And I wonder specifically about whether or not we're within reach of the remote visit to a doctor or remote participation in operations. What's possible?
I had the benefit this past week, and actually I've seen him do this in Europe, Asia, the Middle East, and North America. Dr. Harris's presentation, Dr. Martin Harris from Cleveland Clinic, his presentation on what Cleveland Clinic is doing in its exchange of information and connection between patient and provider. And so someone like that's going to give you a much more aspirational answer of what's possible. I'm going to give you some very basics that I'm still looking for from my doctor because I don't live in the University Hospitals or Cleveland Clinic Hospitals network. The ability to schedule an appointment online. The ability to get results back online. The ability to take on what I was just talking about in terms of my responsibility as a consumer, some ownership in my health care. I still operate in a practice as a patient of at least to me, although when I'm there I see electronic equipment and technology, but from my standpoint as a consumer, or patient as I walk out that door, it's still a paper-based system. I can't get to it. So just some fundamental things like scheduling and results, follow-up consultation, the ability to do things electronically, the ability to share information because I need to go to a specialist that's outside of my community or my network. There are just some very basic fundamental things that I see that I would want. When I look at Martin's presentation in terms of the clinic, I mean, it's a fantastic diagram of very innovative thinking that is tying people not only locally, but internationally together in that exchange of information, and it just makes such a huge difference in terms of the care that can be delivered. We're on our last question. Yes, sir.
Thanks. Thanks for coming and bringing your energy to Cleveland. My main question is 5 to 10 years from now, how do you define your success here in Cleveland?
This, and I'm hoping that it'll be on the short end of your 5 to 10 versus the far end. This will be a place, both physically and virtually, where people will look for the true innovation in healthcare. Innovation that has survived some degree of critical analysis and testing. It's not made up, as we use, it's not vaporware. It's if not in production, it's good enough to be in production. It's waiting for someone to recognize its opportunity. So working with someone like BioEnterprise, I hope that this is a place where entrepreneurs can come to network with others to develop the newest things in healthcare technology and innovation. It's a place where investors will come to find out about the latest. I think if there's one thing that I'd focus on perhaps even more than the testing and the showcase demonstrations that we plan on doing now, it's creating the environment where new things happen. That's what I would define as success in 5 years. Thank you very much.
Today at the City Club, we've been listening to a Friday forum featuring H. Stephen Lieber, President and CEO of the Health Information Management Systems Society. Thank you, Mr. Lieber. Thank you, ladies and gentlemen. This program is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.